It has no regular symptoms, and it's something that most men don't talk about: prostate cancer. But we're doing our best by bringing it back into the conversation. Jim Williams of the PA Prostate Cancer Coalition is here, along with urologist Dr. George Boline. So it is true, a lot of guys don't want to talk about this.
That's right.
Why is it, though, Jim, so important that we are talking about this and we're recognizing what this
Well,
is?
men die of this disease. Almost as many
course.
men die annually from prostate cancer as women die from breast cancer. And because it's an asymptomatic disease, there's no early warning signs. And so we encourage men, you need to go to the doctor when you're well, not when you're sick. And of course, we're emphasizing this during September, Prostate Cancer Awareness Month.
So you want men to be proactive, not just reactive in their health.
That's correct.
So turning to you, doctor, if a man is interested in learning more about this, potentially getting screened, what is your advice? What do you tell these men?
Men need to go and see their family doctor or the urologist and talk about their risk factors. They need to make a shared decision regarding screening. And screening involves a simple PSA blood test and a prostate exam. As Jim pointed out previously, guys who have an increased risk of prostate cancer are African Americans and somebody who has a family history of prostate cancer, particularly in a first-degree relative. So gentlemen who are African American in descent have at least a times increased risk of developing prostate cancer and also dying from it. So those groups, it's very important for them to get screened. We at Urology of Central Pennsylvania, if you don't have a family doctor, if you're underinsured, uninsured, we offer free prostate cancer screening with a PSA and a prostate exam.
That's tremendous.
So,
I know you have an illustration you want to show us and sort of how you go about diagnosing.
Yeah, diagnosing prostate cancer is like other malignancies. It's based on a biopsy. And when a prostate biopsy is necessary, it's usually necessary because there's an abnormality with one of the screening studies. Either the PSA is high or the patient's prostate exam is abnormal. So a urologist would do a biopsy, and it is done under IV sedation or a local anesthetic so that they're comfortable.
Okay.
And there's
But awake.
Awake. But twilight sleep, so to speak, for some. But there's a small probe that's placed up just inside the rectum, and the rectal wall is very thin. The prostate sits right behind the rectal wall, and it's easily imaged with an ultrasound. And we use the ultrasound to guide a little tiny needle that goes out in a split second. Takes little samples of prostate tissue from selected locations. A pathologist looks at it under the microscope and determines whether or not there's any prostate cancer.
So it's a significant process. Can you very quickly, because we're running out of time, Jim, just tell us about the rally and also the 5K that's coming up?
We're having a rally on the 22nd of September at the Capitol. The Lieutenant Governor is going to speak, and we encourage all the survivors to come up at that rally. Starts at 11:30, and then afterwards we have a free lunch at the Firehouse restaurant on 2nd Street for survivors and their guests.
And then a few days later is
the race.
And then
a few days later is the 25th. We have the race at City Island. It starts at 6 o'clock.
Okay, very good. So that's how folks can get involved and take control of their health. Gentlemen, thanks for being with us on the show today. We'll be right back with more Good Day PA here on ABC 27.